People extrapolate what they see in West Africa with what they think might happen here. And I think what we're seeing is a catastrophic health crisis in West Africa and an epidemic of fear here. I mean, I don't disrespect that fear and I don't criticize it, but you've got to evaluate your risk and relative risk based on scientific evidence. And to this day, 2 people have gotten infected in the United States of America. 2 people have gotten infected while they're here. Both of those people were brave nurses who were putting themselves in harm's way by taking care of an Ebola patient in a hospital. Those are the only 2 people who've gotten. Those 2 people got infected from Mr. Duncan when he was desperately ill in a Dallas hospital. They were taking care of him, they got infected. Mr. Duncan had contact with many family members while he was sick. None of those family members have gotten Ebola. So what that tells you, if you look at the scientific evidence, that the way you get Ebola is by direct, intimate contact with the body fluids of someone who's really sick, not someone who is well, no fever, not ill. The risk of that is you know, you never say zero, but it is essentially zero, because this epidemic is going to get under control predominantly by healthcare measures, namely the kind of acceleration that the United States has done and hopefully other countries will do. Hopefully it gets under control before we have the need to use a vaccine. But right now, we're very rapidly on a fast track testing a vaccine. We started it in what's called phase 1 in Bethesda here, and also in other places in Maryland, where you give it to 20 or so people, see if it's safe. By November, we'll know if it's safe and it induces the right response. And then by December or January, we're going to go in a much larger trial in West Africa to see if it works. You don't want to give a vaccine